Okay, so we're live. Welcome. Welcome to our happy hour. I'm Dr. Keira Barr. I am a dermatologist by training who dove into menopause medicine and mind-body medicine. So my aim is to help support women transitioning through this menopausal phase of life so that you can thrive instead of feeling like you're just surviving. And so tonight, I thought it'd be really fun and hopefully informative. And I encourage you to please send your questions, participate so I can give you the answers that you're hoping to get. Really connecting the dots between our skin and our hormones and how we can leverage what we're seeing to actually be empowered to take better care of ourselves, to take charge of our health at this stage of the game, rather than looking in the mirror and feeling frustrated, because I know exactly how that can go. So a lot of times when women would come to me, and even now, I'll preface this by I don't have a traditional dermatology clinic anymore. I stepped away from traditional practice when my own health fell apart. The timing was very unique. So this is part of why I'm so passionate about talking about one of the hormones that doesn't get a lot of attention. So about 9 years ago, I thought I was at the height of my career. I was running ultra marathons. I was in academics, juggling my kids and my family. Thought I had it going on, eating well. So I thought. But over the course of 10 years leading up to that, I had growing and changing pigmented lesions. Many of them were biopsied and were very atypical. And they just kept getting more atypical as the years went on until finally I found a spot on my arm, which I had a diagnosis melanoma. And I assure you, as a dermatologist, who the focus of my practice at the time was skin cancer and melanoma, that really was it was like my worst nightmare. But that was just the tip of the iceberg, because I was also experiencing migraines and bloating and menstrual irregularities, irregular periods, really heavy periods, no libido whatsoever. And at the time, I had no idea what was going on with my body. My doctors didn't really know what was going on with me either. And it turns out that I was in perimenopause. Now, I was in my late 30s at the time, and it's not something that was on the forefront of my brain. I thought menopause was something for older women, women in their 50s, late 40s, 50s, not in my 30s. And really what it came down to was stress. The stress of over-exercising, the stress of, perfectly honest, I really didn't like my job at the time. And juggling, being the wife, being the professional, being the mom, all the things pushed all my hormones out of balance. That stress hormone, cortisol, pushed all my other hormones out of balance. And starting in our late 30s, our hormones naturally start to diminish anyway. So it was a double whammy. And lo and behold, it showed up on my skin as a diagnosis of skin cancer. So that's what I want to kind of impress upon you, that your skin and what shows up on it isn't something to be covered, camouflaged, filled, or fixed. I don't care what the beauty industry tells you. There's nothing wrong with you, okay? Nothing. Your skin is a window to and a reflection of your overall health and well-being. So when something shows up on it, a wrinkle, a blemish, a skin cancer, a rash, that is your body's way of talking to you and telling you that it needs your attention, right? Your skin can be your greatest ally and your greatest cheerleader. But it also is a really crappy confidant. It's going to tell all your secrets. And it's the kind of gossip you actually want to hear because you can do something about it. So tonight we were going to talk all about hormones and skin and bioidentical or hormone replacement therapy, not necessarily bioidentical because there is synthetic and bioidentical. Well, some bioidenticals are synthetic, but that are not bioidentical. So I just wanted to lay the foundation that what you see on your skin can be really good information. And that parlays into the changes that happen in menopause. So what happens? I think it's important to understand that what happens to your skin and your hormones during menopause, first you need to understand how your hormones support your skin prior to menopause. So in terms of estrogen, we always think of estrogen as like the queen hormone. And estrogen is really key for the normal functioning of your skin, as well as your blood vessels, your hair follicles, your oil glands, and our pigment producing cells called melanocytes. And so it's also associated with collagen production, type 1 and type 3 collagen. And collagen gives our skin that structural framework. So it gives us that youthful appearance. It's responsible for increased skin thickness and keeping the skin well hydrated. It increases what we call glycosaminoglycans, and hyaluronic acid is one of those products. And hyaluronic acid, you may be very familiar with. Hyaluronic acid is what lubricates our joints. It's also what many of us spend thousands of dollars to inject into our face. That is what many of the fillers are made out of, is hyaluronic acid. And estrogen contributes to your body's naturally making that. So estrogen is really important from that perspective. Estrogen is also really important for improving your skin barrier function, reducing oil gland activity, and improving wound healing. It also plays a role in helping to modulate inflammation, so keeping the skin from getting red and inflamed. Now, progesterone also plays a role in the skin. The role that it plays isn't quite as clearly demarcated as estrogen, but studies have shown that it does contribute to skin elasticity, pigmentation, as well as increasing the circulation and sebaceous gland activity, especially in the second half of our menstrual cycle. And then our androgens like testosterone can also play a role in our skin. Really, one of the ways that we think about androgens the most is the influence that they have on oil gland production, producing more oil, and also on our hair. And I'll get into that in just a minute. But here's what happens as we mature. So our hormones diminish as we transition to menopause. And I think it's worthwhile to just take a step back for just a moment and define what is menopause, right? I'll full on admit it. Before I dove into menopause medicine, after being in medicine for over 20 years, like I thought medicine was like menopause was a phase of like a time period. The literal definition of menopause is a milestone. It's a day. It's 12 months after your last menstrual period. Everything before it is, well, there's premenopause, and then the for many of us women, perimenopause can last anywhere from 4 years to 10 plus years. So you've got perimenopause, then you have that one day in time, 12 months after your last menstrual cycle, that is menopause, and everything after that is the postmenopausal phase. So I just wanted to kind of clarify that because I think it can get a little bit confusing. So I just wanted to preface that. And for some of us, menopause happens naturally, right? The ovaries start diminishing the production of the hormones, and then eventually we skip our period for a couple months, and then before we know it, it's a year. There are others of us who go into menopause abruptly for medically induced menopause. We've had a total hysterectomy, our ovaries are removed, and it's an abrupt transition. So circling back now to our skin. So as our hormones diminish in menopause, the function that they perform to maintain the health and vitality of the skin diminish as well. And you may notice that as a decrease in sweat, sebum, and also how your skin handles intruders, right? Your immune functions can result in significant changes. And with a decrease in sweat and sebum, you may notice that your skin is more dry. We also know that probably around the age of 50 that the skin, the pH of the skin changes, and we naturally have lipids, fats in our skin. That's how it stays hydrated and protected, and those change. So that's part of why, as we mature, products that you had used for years, all of a sudden they're not working as well, right? Because there's change in your skin. The pHs of your skin is changing. It may cause more irritation and inflammation. And so what we notice, especially as there's a decrease in sebum production, as estrogen is decreasing, you might notice dryness, not just of your face, not just of your extremities. This is where vaginal dryness comes into play as well. We don't think of our vulvas and vaginas as being skin, right? Which is part of our body, but this is skin. And this is how a decrease in hormones can affect your skin. And especially when it comes to vaginal dryness, what is the next step, right? It can make sex really uncomfortable. And as we also know, not only is estrogen responsible for keeping the skin well lubricated, right? The hyaluronic acid and the sebum. So there's dryness. But I mentioned that estrogen plays a role in collagen formation, which gives skin its structural integrity. So as estrogen is diminishing, what happens to skin thickness and the skin integrity? Well, in the vaginal area, the vaginal tissue becomes atrophic, meaning thinner. So there might be tearing with mild irritation, right? So you're dry, the skin is thinner, sex can become very uncomfortable because there could be minor micro tears or or flat out abrasions because of friction. And also may, as the tissue thins too, around the urethra, you might notice that you have increased urinary frequency or increased UTIs. So all of this plays a role as the hormonal shifts in the skin and tissue surrounding these anatomical structures. So I hope that clears up some things. I get asked that a lot. And so I just thought it would be helpful to kind of share that as well. Now, moving back up to the face, as estrogen is decreasing and it's responsible for collagen and formation, what else might we notice? Fine lines, wrinkling, skin sag, and jowling. Now, estrogen is not the only factor responsible for all that. 90% of visible signs of aging are actually from UV exposure. And I live in the Pacific Northwest. I don't know where all of you live, but I would imagine some of you live in places like I do where there's a lot of cloud cover a lot of the time. And so you might think, I don't have to worry about the sun. It's overcast. Let me dispel that myth for you. Upwards of 80% of UV rays get through the clouds. So rain or shine, winter, fall, summer, spring, you are getting sun exposure all year round, which means you want to protect that skin because sun exposure causes destruction of your collagen and your elastin, it breaks them down, damages your DNA. And that also contributes to pigmentary changes, fine lines, wrinkles, skin sag, and jowling. So there's also our diet and our lifestyle. Something else that also can create havoc for your skin and break down your collagen and your elastin and contribute to skin sag is added sugar. And I know, I love my sweets too. But here's the deal. When the occasion, listen, we got to live our life. My favorite prescription to give is dark chocolate, greater than 70% cocoa to get your flavonoids, all your polyphenols, all your good phytonutrients, and a good glass of red wine. Ideally biodynamically grown, minimize the pesticides and all that. I know. It's like a little much. It can be stressful, whatever. You need to enjoy your life. That said, when you are consistently consuming a lot of added sugar, and this is why reading your food labels is really, really important, because our food industry loves to sneak in sugar into our packaged products, and we aren't always paying attention, right? They can just slip it on in there. And why that's a problem for your skin is that sugar can create something called advanced glycation end products. It participates in a biochemical process called glycation. And these advanced glycation end products they age your skin, because these glycation end products bind to your collagen and your elastin, and they make them very stiff and friable, and then they break. And again, leading to fine lines, wrinkles, and skin sag. So there are lots of contributing factors to why we are seeing changes in our skin as we mature. The older that we are, the more sun exposures that we've gotten. The older that we are, most likely we've, indulged in plenty of sweets and such. And it's not just added sugar that creates these advanced glycation end products. It's cooking food at really high temperatures, and things in our environmental exposure, air pollution, and other things. There are many things that can contribute to the formation of these advanced glycation end products. So the more we are aware of what we can control, the fewer fine lines and wrinkles that may accumulate over time. So that's something that I wanted to kind of just share. I cannot emphasize enough. We'll get into more about hormones in a second, but I cannot emphasize enough in terms of, if you want to keep your skin healthy and radiant, is protecting yourself from the sun. Now, I love the sun. I think it's so vital to our overall health, well-being, mental health. But like everything else, we got to weigh the risks versus the benefits. So getting sun exposure earlier in the day or later in the day, so you're not in the height of the intense UV rays, is key, so that you can minimize the damage that the UV rays are creating. Now, when it comes to sun exposure, I'm very passionate about this topic. You can tell. It was the subject of my book called The Skin Whisperer. And they named it that because, as I mentioned at the beginning of this, your skin and your body are sending you messages all the time. What shows up on it are messages about what's happening beneath the surface. And my hope for every single one of you is that you hear those messages when they're just a whisper, rather than when they're shouting. Because in my case, my skin was shouting at me and I didn't hear it at all. So when it comes to sun exposure, I'm just going to spend just another few minutes on this because I think it's really important. When we talk about sun exposure, it's important to understand what is that. So so when we talk about like UV exposure, it's UVA rays, which are what we consider the aging rays. They penetrate your window glass. So again, rain or shine, indoors or out, you are getting sun exposure. Like my desk is right in front of a window. So during the pandemic, everyone's working from home. If you are sitting in front of a window, you are getting sun exposure every single day. So those are the UVA rays. They penetrate your skin deeper and they can break down your collagen and your elastin. And they also can work together with the UVB rays, which are shorter. The UVB rays also fluctuate during the day. This is why we say going out earlier or later, because UVB rays are really most intense from 10 a.m. to like 4 p.m. And UVB rays also do vary during the season. UVA rays don't. They're consistent. And so UVB rays can penetrate your window glass, but they are predominantly responsible for what gives you your sunburn. And UVA rays and UVB rays both damage your DNA and contribute to skin cancer, which most people may not appreciate. Skin cancer is the most prevalent cancer in the US and around the world. So there are more new cases of skin cancer diagnosed in the United States every year than all other cancers combined. Now, the good news is when you can check your skin and you can find that skin cancer or that atypical spot and you catch it early, it's very readily treated. So my invitation, I don't know if you can see my sign, let's go skinny dipping. I invite everybody to party in your birthday suit on the date of your birthday every single month. And you check your skin from head to toe. I'm wearing nail polish right now, which is very unusual for me. But check between your mani-pedis, check your fingernails because pigmented lesions can occur underneath the fingernail. So check between your fingers, between your toes, bottom of your feet. Ladies, you got to get a hand mirror because skin cancer can occur where the sun doesn't shine. So you gotta get real familiar with your intimate bits, and then also recruit everyone you know. Get your best friend, your partner to check your back. Get your optometrist, your ophthalmologist to check in your eyes because melanoma can occur in the eyes. Get your hairdresser to check your scalp, your massage therapist, whoever you're in contact with. Now that many of us are reemerging and you actually can go be seen instead of just virtual care, create your village to help you check your skin. Okay, I'll get off my soapbox now. Oh, one last thing that most of us don't appreciate. Okay, so I mentioned sun exposure, UVA exposure through your window glass. We're sitting in front of a device right now. Blue light. Studies have shown that blue light can also create challenges for our skin, including what we call dyschromia or pigmentary issues, and also penetrate the skin more deeply to break down the collagen and the elastin. So again, even if you're working indoors and you're not heading outside, wearing sun protection every single day, a moisturizer that has SPF 30 is perfect. And to help defend against blue light, getting a tinted foundation that has iron oxides will help protect you against that blue light. Okay. Did anyone have any questions on that? I know that was a lot, but listen, as we are maturing, we are trying to keep our skin healthy and vibrant, and sun protection is one of the key ways. being mindful of your food labels, seeing that there are no hidden or added sugars in there to help prevent those ages from aging your skin. And then back to our hormones. Now, when I started this conversation, one of the biggest aha moments that I had was the connection between stress and skin and your sex hormones. Now, when we think about menopause or we think about hormones, most of us, myself included, prior to my diving deep into this and my own experience, we think about the sex hormones. We think about estrogen, progesterone, testosterone, DHEA, thyroid even. But the most important, I would say, from my perspective, one of the most important hormones of all is your stress hormone, cortisol. And here is why. And this is why it's also important for as we transition to menopause too. So when we are under any sort of stress, right? I know that sounds like a big word. It's mental, emotional, physical, like COVID, for instance. This is a chronic, ongoing stress. We're emerging into what is a new normal, and that's kind of stressful too. But there's still so much uncertainty. It could be an illness. It could be, a divorce. It could be moving of your home. It could be a kid going off to college. It could be dealing with your aging parents. It could be a deadline at work. Stress comes in many forms. But when our brains perceive that there is a stress, it sends signals and a whole cascade of messaging out so that your brain signals to your adrenal glands to produce a stress hormone, cortisol. That's your primary stress hormone. Cortisol, as well as norepinephrine and epinephrine, that adrenaline. What that results in is additional messages being sent around that create inflammation in the body. And the skin is a direct target of that. So when you are stressed, perhaps you've noticed that maybe your eczema has flared, your psoriasis has flared, your acne has flared. This is not uncommon. This is not your imagination. This is very scientifically proven. What's so fascinating is your brain is sending the signals to your adrenals to pump out the stress hormone cortisol. Your skin has receptors for that. Inflammation takes place. Chronic stress can suppress your immune system, making wound healing more challenging, making you more vulnerable to cutaneous infections. Many, many things that can happen with your skin, changing in the pH and the microbiome and making it more irritated and inflamed. What many people may not also realize is your skin has the exact same capacity to create what we call that mechanism that I was talking about, from the brain to the adrenals, the hypothalamic pituitary adrenal axis. Your skin actually has the exact same mechanism. Your skin has its very own HPA axis. So your skin can produce stress hormones. Why is that an issue? Well, cortisol, in addition to creating inflammation and suppressing the immune system, cortisol also breaks down collagen and the elastin, right? The supportive tissue that gives you that youthful appearance. Not only does it break it down, it also prevents repair, right? So chronic stress, right? Acute stress, someone cuts you off in traffic and your heart rate goes up and you have a jolt. That's not what we're talking about. And it's not even that stress in and of itself is a problem. We are wired to survive. We are meant to have this stress response. So it's not that stress is present that's the problem. It is our response to it. And that when we can't kind of get ourselves out of that fight or flight mode where it's ongoing, that's when the challenges arise. Now, how does this come back to the skin? So as I mentioned, our skin has this same mechanism. So it's getting signals from the body, there's cortisol, hitting the skin, and then the skin itself can create these hormones too. So the skin is really getting walloped and really can show stress in many ways, increasing rashes, dryness, inflammation. Not only that, what we see on our skin can create stress. So it's a two-way street. So why is this an issue in menopause in particular? Well, here is the scenario. You are wired for survival. Your body is going to prioritize creating the response, the stress response. You can live without estrogen, progesterone, testosterone, DHA. It wouldn't necessarily be desirable, but you can do it. You cannot survive without cortisol, without your stress hormone. So your body is always going to prioritize it. So what happens is when your body, your brain, your skin perceives a threat and a stressor of any sort, it's going to prioritize creating cortisol. As a result, it's going to shut down these other hormone pathways because all of your hormones, the basic building block is cholesterol, and it's a very complicated cascade, but they all are related. And I always think of like cortisol is like the top domino, and it can knock everything out of whack. When your body is trying to prioritize creating cortisol to help you get out of whatever jam your brain thinks that it's in, it shuts down production of your other hormones, including progesterone, testosterone, and estrogen. In fact, it may even recruit testosterone and estrogen to help with the stress response because they're very energizing hormones. Why is that a problem? Especially in menopause, your ovaries are already diminishing their production, right? So you're already at a deficit. Now you're under chronic stress and duress, and your body is going to consume whatever it needs to, all the building blocks that potentially would go to producing whatever little your body can produce of your sex hormones. It's going to be recruited to produce the cortisol. So this is why, it feels like wellness is a trend and everyone's talking about mindfulness and other things, but this is a big reason why. Biologically, we're trying to rebalance our body's ability to function optimally, especially during menopause. And this is why when we're stressed and hot flashes may increase, warm rushes may increase, insomnia may increase. And that's part of the reason why the focus of the work that I do is really to support women manage their stress response, create the building blocks to really examine what's happening in their life, what is in their environment that we can get rid of, really empower you to minimize the stressors in every facet of your life and fill your toolbox with tools that can help you feel more calm, more energized, more relaxed. Because in menopause, hot flashes can disrupt your sleep. You're feeling exhausted, lacking energy, all the things. So that's one of the biggest reasons why when I work with women, I actually focus more on getting cortisol levels under better control because that makes everything better. Even women who are on bioidentical hormones are still, their levels, even when you test them, their levels look fine, but they're not sleeping. They're having hot flashes. They're feeling overloaded, overwhelmed, and it's just too much. But when we really focus on self-care, which is why we're here tonight, and taking care of yourself and figuring out what you need and giving yourself the grace and compassion to put yourself first, because that is not selfish. You cannot pour from an empty cup. They start to feel better. So I had one patient who she was on bioidentical hormone therapy and her levels were great, but she wasn't sleeping. She was waking up in the middle of the night, like sweating, hot flashes. And kind of went through the medical history. There wasn't anything that stood out except she was starting a new program. She was feeling a bit overwhelmed and overloaded with her schoolwork. So we focused on breathing together. We focused on other modalities to help her calm that stress response. And I kid you not, from that night forward, she slept every night after weeks of not sleeping. It's because we don't realize how much stress truly impacts our hormones. And again, body's going to prioritize elevating that cortisol and the adrenaline, so you're getting heart palpitations and such. And it's going to diminish your body's ability to generate whatever sex hormones it's capable of generating, and just keep your body revved up. So, so many facets. Menopause, the midlife, it's a very dynamic time. But when you can tune into what's happening on your skin and in your body, it's an opportunity for you to be able to take control and take charge, right? So another thing with skin is big complaint that I hear is about hair. So women will say, I am going bald and I'm growing a beard. WTF, like what is happening? Okay, so I just wanted to share a little bit of information about hair, because that, you have a bad hair day and it's a bad day, right? And so to set the stage, I just want to give a little information about hair. So your hair grows in 3 phases: a growing phase, a resting phase, and a falling out phase. And your hairs are not all in the same phase at the same time. And so this is why, with regards to your sex hormones, you may have noticed if you were pregnant, that your hair started to look very lush and full, because estrogen plays a role in prolonging the growth phase of the hair cycle. And so you might have also noticed after you had your baby, you notice mass shedding. And you're like, oh my God, I'm going to go bald. What's going on? It's simply because as your estrogen level dropped, like plummeted when you had the baby, those hairs shifted from the growing phase to the falling out phase. And you notice the shedding. So what happens in menopause? It's not as precipitous as a drop unless you've had medically induced menopause, and then you might notice that a little bit more dramatically. But as estrogen is diminishing, you don't have that influence on the hair follicles. So you might notice that you're shedding a little bit more. The hair is a little bit thinner. And there's a second part to that. So I'll back up. The most common causes of hair loss in menopause are female pattern hair loss, chronic telogen effluvium, and I'll explain all of these, and chemical and physical trauma to the hair. So coloring your hair, straightening your hair, chemical processing of the hair, or just manual manipulation of the hair, flat irons and other things. So the chronic telogen effluvium is where I will highlight for the moment, because anagen is the growing phase, telogen is the falling out phase. So, you may have experienced it, like I said, during pregnancy, where it's kind of this abrupt change from anagen to telogen falling out. As we mature, chronic telogen effluvium that just means that your hair is chronically in this stage of the more hair follicles are in the falling out phase. And what contributes to that? Stress. Stress, stress. And so again, it's not always just the emotional and mental stress, although these are big ones, because let's face it, ladies, most of us put ourselves on the back burner. We think, oh, we'll take care of ourselves later. We'll, I don't have time for a massage or a manicure, like thinking that that's what self-care is. And that is. But on a day-to-day basis, literally just checking in with yourself and saying, like, what do I need right now? What would feel like love to me right now? Maybe that's having a cup of tea. Maybe that's just sitting doing nothing. Maybe that's telling your kids, like, you need to make dinner tonight. Delegating, deleting, and really deciding what you need to do. But chronic telogen effluvium is one of the main causes of hair loss in menopause. Now, the second main cause of hair loss is female pattern hair loss. And this happens similar to male pattern hair loss. So our androgens, that testosterone, is converted to a more potent form called dihydrotestosterone. And it's converted to that more potent form by an enzyme called 5-alpha reductase. One of the ways that conversion can be minimized is by progesterone. Progesterone, when it's in normal levels, will block that enzyme, so testosterone can't be converted to its more potent form. Now, the problem is, or not the problem, but what happens in menopause, starting in our mid to late 30s, progesterone is the first hormone that starts to diminish, right? So this is why so once progesterone starts to diminish, not only is progesterone like the great calmer, and you might notice that you feel a bit more anxious than you had before. You weren't anxious before, all of a sudden you're anxious. Well, your progesterone levels may be going down. Your sleep also may be disrupted because progesterone plays a role in calming the body, interplaying with the brain chemical GABA that helps relax. So as that goes down, sleep may be disrupted, anxiety may increase, and then your hair. So without that heavy influence of progesterone to block that conversion of testosterone to its more potent form, here's what happens. On your scalp, this more potent form, dihydrotestosterone, which I'm going to abbreviate as DHT, DHT influences the hair follicles on your scalp by making them shrink, what we call follicular miniaturization. So the hair follicles get smaller, and what that results in is hairs that are thinner. The caliber of the hair is much thinner. So your hair, and so it may look like a widening of the part. So your estrogen, so think about this. So estrogen is decreasing, and so there isn't that influence of hair growth, right? So not as many hairs are in the growing phase. And now you have dihydrotestosterone causing the hair follicles that are there to kind of shrink, and then the caliber of the hair is decreased. So it looks thinner, there's decreased density, a widening of the part. On your face, DHT has the exact opposite effect. It causes the hair follicles to grow. It stimulates them. So you get coarse, dark hairs on your face. So hopefully that makes sense and may answer some of the questions of like, oh my God, what is happening to my head? And I'm growing a beard. So there you go. So hopefully that was helpful. I did notice we had a few questions coming in. I know I haven't really jumped into bioidentical hormones or hormone therapy yet. And part of it is I really wanted to set the stage for what do our normal hormones do for our skin and our hair, and what happens in menopause as they diminish. And so hormone replenishment therapy can be a good option for many women. If you look at the literature, the benefits outweigh the risks, but it is a very personalized and individualized decision that you make with your provider. And here's also why I talked about other things versus just jumping right into hormone replenishment therapy. Based on my experience of prescribing for women, and I've actually stepped away from that part, not because I don't think that there's value in hormone replenishment therapy. I do. But what I found is that despite women being on adequate levels of hormone replenishment therapy, they still weren't sleeping. They were still exhausted, having no energy, and feeling miserable. So as we are transitioning to this next phase of our life, I think that hormone replenishment therapy can be a very valuable asset, but it is one part of the equation. We really do need to take a step back and ask ourselves, where are we at? What do we need? What do we want at this stage of our life? Because as I shared, I think multiple times now, and I know this on such a deep personal level, the impact that stress can have both physically, leading to challenges, inflammation, chronic illness, and emotionally. So hormone replenishment therapy can be very beneficial. There was a great question that came in that, can I start HRT at 72? Never went on it due to beliefs about it in the past. Family history, very healthy. And so is it possible? So yes, unfortunately, that Women's Health Initiative study back in the early 2000s did create a lot of challenges, not only for women who had been on therapy and now were afraid because of the reports of increased risk of heart attack, stroke, and breast cancer, but also the physicians who are now afraid to prescribe. Since that study, follow-up studies using that same cohort of women who were studied, essentially what they found is that, in fact, they recanted essentially their findings that there was not an increased risk. That being said, it's important to understand how that study was done. The average age of menopause is about 51. The women in this study, the vast majority of them, were well above menopausal age, in their 60s and up. They also had a history of smoking. They also had a history of heart disease. They were overweight, not the healthiest bunch. And so the other caveat is that what they used, the hormone replacement therapy that they used, were synthetic. It was conjugated equine estrogen, so estrogen derived from horse urine, and a progestin, medroxyprogesterone acetate. So when additional studies have been done, really what it comes down to is knowing what your individualized risk is, but using not derived from horse urine. There are people there. It's when we talk about hormone replenishment therapy, it can be very controversial because there's a lot of different opinions. My personal opinion is to use bioidentical hormones that basically they're derived from plants and such, but they are biochemically similar to what our own body produces, which is what similar, bioidentical means. The other thing is progestin, medroxyprogesterone acetate is a progestin, and that's where the challenges were with blood clots and other things. So we look at using progesterone when you are taking hormone replenishment therapy. So using bioidentical hormones that are biochemically similar to what our body naturally produces, and making sure that you are using a progesterone, not a progestin. The other issue is the formulation. There are many formulations on the market. There's oral estrogens, gels, creams, patches, pellets. This is my opinion, and you can find other practitioners who won't agree. I use topical estrogens only. This is how I was taught by my mentor, who's, been prescribing bioidentical hormones for 30 years. And based on the literature in terms of where the challenges lie, it's with the oral estrogens. And in fact, the recommendation is that over the age of 65, women who are on oral estrogens should be converted to a topical formulation. So my thought is, if there's any concern, if there's any risk with oral at a certain age, why would you be on it in the first place? So that's just my caveat. And with pellets, in terms of formulation, the challenge with pellets, and some women love them, you can't titrate you can't control the dose. Once they're in for months. And so some of the side effects, you just got to struggle through it. Now, circling back to this fabulous question, is 72 too old? And the answer is not necessarily. And here's why that is. So the recommendation from what we know is to start hormone replenishment therapy within 10 years of going through menopause, right? Either, that milestone day, within 10 years of going through menopause, or less than the age of 60, before the age of 60. Now, there's a caveat to that. Studies have been shown that women who are over the age of 60 can be started on hormone replacement therapy. But what they found is in that population, there was a slightly elevated risk of cardiac events. And what they found is that within the first year of starting hormones is really when there was an elevated risk of adverse effects. After that 1-year window, they were fine. So what does that mean? It doesn't mean that over the age of 60, or if it's been more than 10 years, that hormone replenishment therapy is off the table for you. What it means is that you may need a more rigorous medical workup to the best of your clinician's ability, evaluate the health of your cardiovascular system. So that might mean that you need like a stress echo or working with a cardiologist to really investigate that for you. Again, like I said, very individualized decision, but it doesn't mean that it's not an option for you. In the last few minutes, I wanted to also address another question that came in, that they're an impact athlete, dancing, triathlete, doing walks for 60 years, excellent diet, consistent BMI, great. Why with this healthy lifestyle did an osteoporosis diagnosis be delivered? Well, here's the thing. I don't know your status. Are you on hormone replenishment therapy? Because we know that estrogen is key for the health of our heart, our bones, our bladders, our skin. So that's one consideration. Vitamin D, even though, and the health of your gut, are you absorbing what you're eating and the nutrients? So there's many factors at play. So it's always a challenge to answer these questions, like firmly not knowing anything about medical history. But impact exercise, weight training, all very important for your overall health and well-being. And we know it can help with bone health, but that's not the only thing. So if you haven't had your vitamin D levels checked, make sure. And from a functional perspective, in allopathic medicine, we look at a certain range, and usually that range is much lower than a functional doctor might look at, like how does your body optimally function? That vitamin D level between 60 and 80, although maybe closer to 70. But many of us, especially depending on where you live, it could be in the 20s or in the 30s. So it may just not be optimized enough to support bone health. And again, gut health. Are you able to absorb the vitamins and nutrients from that healthful diet? And again, so that's where working with a functional nutritionist or an integrative or functionally trained physician who may be more inclined to do testing on you that are above and beyond what traditional medicine can do to explore some of those opportunities. All of these are opportunities to support your health and well-being. So I'm almost out of time. I don't know if anyone has any questions, any burning questions that you'd like to ask. I hope that this was helpful. I know we covered a whole range of things, and I feel like I could go down a rabbit hole, like a million different rabbit holes when it comes to skin and hormones, and especially the impact of stress on our overall health and well-being. And this is just my invitation to you that when you look in the mirror, and you might see those fine lines and wrinkles, and you might see those dark circles under your eyes, or you might see that rash or that breakout on your jaw, that have some compassion and know that your body is doing the best that it can, right? Remember, it is wired to survive, and that's exactly what it's doing. Our goal would be to help you thrive, but just know that your body is doing exactly what it needs to be doing. Your skin is doing exactly what it needs to be doing. It's giving you information that, a little nudge, like, hey, maybe you need a little TLC. Maybe you need to consult with a healthcare professional to support you right now. And so that's just how I will leave it. But I want to thank you all so very much for joining me for this happy hour. Feel free to reach out to me if you have questions. My website is drkeirabarr.com, or on Instagram at Dr. Keira Barr. Shoot me questions. I'm happy to answer. And I'm also just so, so grateful that you joined me tonight. And remember, don't forget to go skinny dipping every month. Party in your birthday suit on the date of your birthday. Check your birthday suit for any uninvited guests, right? Because skin cancer is the most prevalent cancer in the US, and you can find it, and you can take control of your health. You can save your own life. So with that, I'll say good night, and thank you so very much for joining me.